Hi, I'm Andrea Ott. I'm a clinical social worker. I'm a clinician here in the United States, and I also am a clinical psychologist in my homeland, is Ecuador. I want to talk to you and about some questions that people, often ask me. People say, well, why do you get so political as a psychotherapist, and why do you think that systemic psychotherapy, which is a framework I work under, and I own Systemic Psychotherapy LLC, is so political? Why do you think that there is this aspect? And I say, well, because inevitably what we notice in the treatment of very sophisticated mental illnesses, as I've come to specialize in, I specialized in complex trauma, and I taught family systems therapy at Fordham University, and obviously systems therapy, community work is what is my strength. I decided to develop interventions that were much more forceful, we would say, into systems and families, and kind of out of the norm, like flamenco psychotherapy, which is a somatic catharsis, and the use of art, acting for the splits. Because in a lot of ways, when I say that psychotherapy is also political, it's because no human being is born with a mental illness. And when we see an entire system that is having a mental health crisis, right, where we are starting to see personality disorders in a lot of the mass, in a lot of like the normal clinical case walking in outpatient, complex trauma in childhood that's invisible, that's secret, families with a lot of secrecy, families with a lot of denial, a lot of resistance in treatment, a lot of projection identification, a lot of a split. We also have to start talking about the political change in the collective that needs to happen, to really start to understand what is it that happens to the psyche of a young child when we're talking about some of these catastrophic things that happens. It's like a bomb in the nervous system of a young child that creates a narcissistic injury. And that narcissistic injury generates a split. In usually normal dynamics, before we had the DSMs, the Manual of Disorders, we usually before only categorize the psyche in 3 dimensions: psychosis, neurosis, and perversion. Psychosis meaning states of consciousness that are altered, delusion, hallucination. The main premise of that is I'm the one, right? Neurosis meaning rumination, compulsion, histrionic, and obsessive disorders, right? And we would have narcissism more around that, right? In between psychosis and neurosis. And perversion, which is ultimately, a very dangerous disorder that causes, antisocial personality disorders and psychopaths, right? Which is more about the cross of the law and the edge, about being on top, right? Being on top. And seductive, or crossing of boundary of the law, right? An edge about that. So we'll have, in general, every single human being has some of that. You could have, in normal dynamics, almost all of it. Your psyche could range. You could have all that range. That doesn't mean that you would have a disorder, right? A clinical condition like schizophrenia. You have to have hallucination. You have to have a clear delusion, and it actually has to have no reality, right? Like, for example, if you're a survivor of complex trauma, you have a tendency to be more paranoid than other people, or to distrust relationships more often than other people. That's a tendency you would have perhaps developed. Also, you would perhaps need extra attention or be more sensitive to rejection. That doesn't mean you're borderline, but you might have that irritability, sensitivity. You might have a hard time with relationships. You might get hurt in relationships, so on and so forth, right? That doesn't mean you have specifically a personality disorder. It could be that you didn't develop a personality disorder. It would all depend, and this is what's important, and this is why right now my cause is to prevent these disorders in our youth. This is what I want you guys to pay attention. This is the treatment. The thing about it is that if you get the mental map of a narcissistic injury, the triggers, where is it that the narcissistic injury has been created? What's the negative cognition? Like, negative cognition could be like, I'm awful, I look awful, nobody loves me, nobody cares, I'm not worthy, I cannot live in this world. If that you are able to tackle, to understand, right, then you can create awareness. The person can wake up and say, oh, this is my negative distortion, this is where I could never go. And if any relationship causes me this, I will need to develop an intervention to say this. This is what causes me this injury. Please don't do it again, because I can't do this. Why? Because the nervous system, every time that triggers the narcissistic injury, you get in survival responses. And so the nervous system has a tendency to either dissociate, flight, freeze, response, and then that goes into the whole dynamic of psychosis, perversion, and neurosis. For example, if you have a tendency to flight, to run, right, you would have more psychosis tendency to create whatever you need to create, recreate whatever is in your mind to survive, right? If you have a tendency to fight, you'll also create, more mood dysregulation disorders, fighting responses, manic. And if you had a tendency to freeze, you would have more depression, right? More anxiety, right? More fear, more terror. And if you have a tendency to, in some clinical literature, if there is this survival state called predatorial survival state. If you have a tendency to think you can get away with whatever you want to get away with, and that you keep going, then it's a cross of the law, and then you go more into perversion, right? So then this is the thing, that if you find those things and the main symptom and where it's going, you could, in a young mind, prevent actually a personality disorder by really targeting the symptom. And what would need to happen is that actually, a teenager has to work with a therapist or, a safe person to develop that safe relationship, find out the true critical symptoms of the narcissistic injury. And for that, we use more psychodynamic techniques, more psyche techniques, more expansion of that collective shadow, more even knowledge of other things if necessary. If to tackle a narcissistic injury, what has happened? Then you implement an emotional regulation method, a mechanism that would work for that person. For example, right, in my case, because I'm a survivor myself, I needed a much more of a cathartic release, a soma cathartic release. That's why I started to study intensively flamenco, as a very much grounding, cathartic, going back to the root of my childhood, my family, because I have migration trauma, and migration trauma plays a big role in maintaining my mental health. So a lot of people like that, and I'm also a kinesthetic oriented person. I sense, I feel from energy. So that's a method that would work for me. There are other methods that could work for different people. Like, for example, art, tactile, visual, organizational skills, grounding, gardening. All of those things is what need to be implemented. And I suggest in a community effort, right? This is what I talk about systemic change, is that if we want to protect the lives of our youth, if we want a better future for our youth and for our childhood, we will have to actively participate in that change. The parents, the communities, we have to give them tools, because they can't just figure it out. It's not like we could just figure it out, right? Psychology is an entire science. We still are figuring it out. Social work is an entire science. We're still figuring it out. We're still inventing, creating, trying to get the right treatment for the things that are presented to us. Okay, I hope you have a wonderful day and enjoy your weekend. Thank you.